Welcome back to Herbie's Eczema podcast. For this today's episode, as you may see in the title, we'll be doing a product explanation which we actually got from doing road shows in the past. One of the products that's very often we got, and this is actually medical certified, or even there's a sticker by Penang Adventist Hospital
What we are holding now is a tube of steroid cream that is usually most widely prescribed by dermatologists to anyone with sensitive skin condition.
So and we've got it the most, so we can say it's a very general one.
Since in every roadshow we have this mugwort balm and steroid exchange program. We welcome everyone to bring their own steroid cream regardless of it's a new or being used before. Then we will do one by one exchange to our full size mugwort balm. This one, we are quite generous, like in a sense. So if you give us this, we will give you one of this to try it out. This is 30 gram and this is 15 gram.
Without bothering about the weight when you exchange.
So you can, with this balm, enough amount and quantity for you to try it and test it out for at least a month, I think, depending on how serious your eczema is. Yeah, then you can see whether it's effective for your skin or not. So if you bring one steroid cream to us, we exchange it for free, absolutely free, no question asked also.
So do stay tuned for road shows. If we do any updates. Do stay
Even
tuned.
if a steroid cream is for the dermatologist prescribed to your brothers, you can still come take it, exchange it for us. We don't question like who is the patient.
Right now.
Unboxing together, yay! This is the old steroid cream from one of our customers.
As you may see from the stickers, if you guys are watching this. Right. This is what the cream looks like, the packaging and everything. We're not going to cover this up because it actually does help with eczema.
This is the most widely prescribed.
Right. And this paper, I know some people, when they see a paper or even the manual, a lot of people will not bother to even look or even read through it. But then today, we're going to be focusing on that, which is reading through and even researching with you guys on board. Yeah.
When I read some of it, right, I feel the information is actually quite vital and important. But I believe but majority of patients that got prescribed by this, they won't read this because it's from a doctor, right? So I assume it's safe because a doctor gave me this. But actually, there's a lot of precaution, and warnings inside this sheet that we should definitely pay attention to.
So I know as what Harper mentioned about the dosage. Actually, even inside the paper itself, actually does mention about like how much a person should take. So if you actually feel like the doctor's prescribing you because they are doctors, they're experienced, they know how much to actually prescribe to someone, you can actually follow the paper if it's not enough for you when you follow the doctor's advice. This cream is actually called Fucicort Cream, or if anyone wants to help better my reading, it's called Fucicort Cream.
Fucicort.
And this cream is actually registered, so no one can actually take this away. For what actually is made of, it's made from fusidic acid, beta-metasone, as a valerate for it, and even it is preserved with cresol.
We are not chemists, so our pronunciation a bit off.
Yeah.
I'll try our best. And we will put the spelling of each ingredient
Inside the subtitle, you can see. As you can see here.
What actually is fusidic acid? According to NHS, which is National Health System of UK, United Kingdom, fusidic acid is an antibiotic. It works by stopping bacteria from growing. As we all know, eczema is likely to be triggered by a type of bacterial group. So I believe this cream works. The mechanism behind it is to stop the bacteria from overgrowing. So fusidic acid is used to treat bacterial infection such as skin infection and also eye infection also. And fusidic acid only available on prescription. That means only a doctor can give you this.
Meaning it's very safe. You cannot simply.
yeah,
Meaning
yeah.
it's a very strong acid. Like you cannot simply.
Yes, and it need to be used under governance of Ministry of Health or a healthcare professional. If someone give you a cream that contain this
Fusidic
acid, if that someone is not a healthcare professional, then you should be very, very cautious about it. Usually the healthcare professional need to see the condition of skin first. Only they can prescribe the right potency for it. For example, like in this Fucicort cream, right? Fusidic acid is 20 mg. Yeah. And there's different kind of steroid cream that is with different potency of this. Yeah. And maybe different kind of bacteria need different kind of antibiotics. Yeah. And some healthcare professional can determine or judge by just the appearance of the skin.
Is their experience what it
yeah. Some bacteria might cause the skin to look yellowish. Some is like white color. Some is like greenish. Don't know, right? So by looking at it, some healthcare professional can determine or decide or judge like which cream actually is better for this kind of condition. Yeah.
Right. The next component, which is beta-metasone.
Beta-metasone is a type of medicine known as a steroid, also called a corticosteroid.
Which is what we have been talking since now. This is actually a steroid cream that is focused to help you with your skin condition.
But this cream only contains 1 mg.
Which is not very strong.
That's why there's most widely prescribed because there's a lowest dosage, I believe.
Because
so there's a starter of steroid cream. Once your skin like
used to
it, then there's a higher rank of
most probably because steroid may what I've learned myself. Steroid actually affects your hormones. So they're giving
a lot of side effect. A lot of it. We will be talking soon in next few episodes. I don't know. We dig a hole for us to jump in first. Then the preservative doesn't matter lah. Any cream or any skincare product need to have like some preservative one.
Which is for this one is chlorocresol.
I believe it's a type of fatty acid or cholesterol. According to National Center for Advancing Translational Sciences, chlorocresol is used in various preparation for skin infections and wounds. It also used as a preservative for skin cream.
Antiseptic and even disinfectant.
Not just a preservative. It serves multifunction also.
Meaning, it's like what was about the fusidic acid. It actually helps to clean the wound. It actually is as a cleaner also.
But interestingly, according to this website, we will include it in the reference in the description box. Chlorocresol produce potential life-threatening effect, which includes dermatitis. Dermatitis is the medical word for eczema.
Oh.
Then why they use this?
It may not even avoid. It actually might even be short term.
So you put two things that heal eczema and one thing that cause eczema. But they say might lah. But potentially lah.
But right now when I'm seeing in the National Institute of Health, right, the chlorocresol appears as a pinkish to white crystalline solid, meaning maybe as a solid the carrier of this substance.
So they need a carrier. Just like what we described in EP episode 2 and 3. Usually skincare product need a carrier agent. But then why this?
I don't know.
They can use glycerin or other form of safer carrier.
Maybe you have to as a cleaner also because this one is also a cleaner agent.
We are not chemists lah. Maybe so it's
anyone that
due to the chemical structure.
Anyone that knows anyone.
We are not going to discuss it anymore.
Anyone that knows the answer actually, do let us know lah.
Because we are not chemical.
We also would like to learn about more about chemical.
Yeah. I was a public health researcher lah, so.
You do know like some better mediums.
I do know some of it, like epidemiological basic of findings of eczema, something like that, but not into that deep of like chemical structure. I do know some carbon structure whatsoever, But into that, yeah, need to know more research.
Anyone that knows about cholesterol, do let us know.
Yeah, and please let us know why they pick this ingredient as a preservative or carrier instead.
I'll read through properties, then we'll explain about the contents later on. Fucicort combines the potent topical antibacterial action of fusidic acid with the anti-inflammatory and antipruritic effects of betamethasone. Betamethasone valerate is a topical steroid with rapid effect in inflammatory dermatosis. Even refractory conditions can often be treated successfully. When applied topically, fusidic acid is effective against Staphylococcus, Streptococcus, Corynebacteria, Neisseria, and certain Clostridia and bacteroids. And the last is the antibacterial activity of fusidic acid is not diminishes in the presence of betamethasone. That's why in this cream also I would say, as what we're saying, is a steroid which is like a enhancer in a sort lah. Enhancers, that means that's why they're putting a much more concentrated of fusidic acids in towards the mixture.
They also kill off a lot of bacteria group, right? And as I understand, these groups of bacteria usually are highly related to eczema and sensitive skin. Our normal human skin, we have bacteria on our skin, but for someone with sensitive skin or with eczema, they have higher percentage of these bacteria. So I believe Fucicort works by its antibacterial effect.
I mean, it's a
Of
cleaner,
course, the
cleaner
steroid,
agent.
just kill off like some of these bacteria to restore into the healthier bacterial level to maintain a healthy environment for this bacteria to stay, but not to trigger eczema. I believe this is one of the mechanism. See, right, by reading through this sheet, we learn so many things.
Refractory. What's refractory actually? Do you know?
By a researcher from Journal of Allergy and Clinical Immunology. It says that in the studies, severe refractory AD which is atopic dermatitis, which is eczema, is primarily an atopic disease. Atopic basically means surface or skin, characterized by increased level of total serum IgE and positive skin test to dust mite, moles, and food allergens. What does it mean? Sorry, it's so scientific again.
I mean,
it means like a person that has a severe eczema that is allergic to a lot of things, they straight away group them as a refractory eczema case. So even if you get exposed to a lot of allergen in your daily life, this cream can still stop you from having eczema. Sounds very good, right? But we continue to read. You don't go by here and directly get this.
So what she mentioned about topical, meaning topical is skin surface.
Topical is skin, surface, skin. Dermatitis, eczema. Just a atas way of saying it in medical term.
For next part is indications. Fucicort is indicated in inflammatory dermatosis where bacterial infection is present or likely to occur. Inflammatory dermatosis include atopic eczema, discoid eczema, statitis eczema, seborrheic dermatitis, contract dermatitis, lichen Syphex chronicus, psoriasis, discoid lupus erythematosus. These are what we're talking about is like the types of eczema or even dermatitis that this actually will help with. So for anyone that actually trying to buy this and may not know what kind of skin condition you have, you may tell them, or even if you know what kind of dermatitis you have, you may even tell the doctors you have this kind, they may prescribe you with this specific cream also.
You don't need to tell the doctors. Doctors, by looking at your face, they know what to do. They have trained eyes. That's why they study for so many years, right? We will scan this whole thing as a PDF and upload it somewhere. Don't worry. Okay. Even you don't get prescribed by Fucicort, you can still read this from this.
On towards the next, we'll talk about a little bit about the dosage, which is written here. Lesions, what it means is towards the like scars or even open areas like that's not covered by skin. So for uncovered lesions, is 2 to 3 times daily applications, and for covered lesions, less frequent applications may be adequate. Like what we said just now, doctor may be prescribing you at like the experienced dose, but if you feel like you need more or less, do get to know, or you can follow this paper like the warnings. All right, on to the next part, which is the more serious part, is that you would really have to focus is the contraindications. All right, let's start off is hypersensitivity towards fusidic acids, sodium phosphate, betamethasone, valerate, or to any of the excipients.
Ooh, so even though this cream is prescribed to treat eczema, but where some people might be allergic to
Towards
this.
yes.
So same like other skincare product, you need to do a skin patch test. Not like just trust doctors entirely, right?
Because they may not, I understand like some doctors may not take the time to actually go through with a patient, as they also have. So skin patch test, shortly is you try to use a small bit of the thing you try to use, rub it on your skin, then wipe it off, see if there's any infections, or if you want to see a physical representative of this test, you can go towards our Instagram.
Yeah, we did. I did a drill before lah, like how to do a skin patch test.
So
Yeah.
if you want a physical representation, do head there to see.
Because just apply some here lah. Why I pick here is because here is the thinner skin layers and not much hair to obstruct.
For listeners, it's the beneath your arm, which is the
inner arm.
next is due to the content of corticosteroid. Fucicort is contraindicated in the following conditions of systematic fungal infections.
Oh, so that means if you have fungal infection, you shouldn't use this.
Meaning it may cause it to happen.
Oh, it may cause.
Yes.
Okay.
And this is not a substance for anyone that's listening. The corticosteroid is not mentioned inside the ingredients list of the main three that we've mentioned just now.
I thought it's supposed to heal infection.
I guess what comes around goes around. Let me see what's
So for some people it really heals, but some people
May
it
come
might
back,
cause
yeah.
or trigger. Basically, it's a skin condition that is infected by fungus. It can be anything, can be near your nails or body or armpit or even your private part, like somewhere that's warm and moist and crease skinful area lah. Basically, yeah, this is what I can see it from various search results.
which is primary skin infection caused by fungi, virus, or bacteria, either untreated or uncontrolled by appropriate treatment. This part we'll get on towards the next of explaining it, because it's labeled as see special warnings and precautions for use, which is the next part we are going on. Next is skin manifestation in relations to tuberculosis, either untreated or uncontrolled by appropriate therapy. Prurial dermatitis and rosacea.
So really need to do patch tests when you get this cream,
Yeah.
cause it might heal or it might trigger more skin condition.
In the meaning of contraindication, it may cause what it actually.
They are quite careful lah. They use the word may, potentially, might.
So
it's not like a must happen or might not kind of relationship.
Here, we'll get on when we see back the word. I think the patch test. I think here actually got mentioned. Yeah. Alright. We want the special warnings and precautions for use. As we mentioned, the most you have to be careful about using this cream is long-term continuous topical therapy with Fucicort should be avoided. Meaning this is a very concentrated cream and you should really not try to use it for long terms.
Oh, but from our experience when dealing with our customer, a lot of them using this for years.
And
And how do you define long term or short term?
yeah. using this cream for short term or even let's say a few months, it may help you to actually clear it up. But if you use more than that as a
Not
precaution,
few months, few weeks.
for even a few as precautions, because if you see it come out, it might come out as because of you actually using this cream. Because it even says not even being sensitive to this cream, but it may even cause to come back.
I read it somewhere from some of the journal. I believe it's Journal of Dermatology or any allergen or immunology. I don't remember lah, but there's a journal, there's a research article saying that if you use this for long term, it will hurt your own body, own nature ability to generate lipid. Lipid is the content, the thing that help your skin barrier intake to help to protect your skin barrier. But if you use this for long term, your skin cannot generate that lipid anymore. This is very scary, you know. It's like this thing is supposed to heal your eczema and help you to get back a healthy skin, but it also take away a lot of things from you. It might trigger your eczema. It might cause a lot of side effects, which I believe
We're reading right now, we're going
second page there's a lot more cautions and potential side effects mentioned, and you will also hurt your nature lipid generation ability. So it's your call lah whether you want to use it or not.
Yeah, even like I think some people even with like diabetics, all those they're prescribed for long term medicine, like which is what we say, when your body is used to something, your body will rely on it.
Yeah. Some people also say that too. Eye drop, which I don't know lah. I haven't done any research to it. Since if you use eye drop for long term, your tearing, in the tears, will not as healthy as before anymore, because your eye is always moist, right? So the tear duct won't generate as much as tears to keep your eyeballs moisturized or hydrated as before. I don't know whether this is true. I need to do more research to reach a conclusive conclusion.
If anyone actually done this, you've did it before, do let us know.
Let us know. Yeah.
Right. Moving on, second is depending on the application site, meaning where you actually apply this, possible systemic absorption of betamethasone rate should always be considered during treatment with Fucicort. Which understanding is depends on where you actually apply this, on which part of your body. You may be absorbing more of the betamethasone valerate.
Oh, so it's like if you apply it on somewhere where thicker skin, you might not absorb that much. But somewhere there's like thinner skin, you need to absorb
You'll be absorbing.
you okay, understand.
For next is due to the content of corticosteroid, as we've mentioned inside the contraindications, should be used with care near the eye. Avoid getting Fucicort into the eye, see undesirable effects, which is what we are talking about later on. What it means is this cream, it may be a strong cleaning agent, but you should not try to. You should avoid the eyes. This should not be. This cannot be used for eyes. Like
eyelid eczema, a lot of people have it. But when you're using this, right, you need to be very, very careful. Because it might hurt your vision. Am I right?
I'm not sure.
I think so. The second page
We'll see later on.
mentioned it.
We'll see later on if anything mentions. Even talking about that, visual disturbance. The next may be reported with systemic and topical corticosteroid use. If a patient presents with symptoms such as blurred vision or other visual disturbance, the patient should be considered for referral to an ophthalmologist for evaluation of possible causes, which may include cataract, glaucoma, or rare diseases have been such as central serous chorioretinopathy, CHCR for short form, which has been reported after use of systemic or topical corticosteroids, which is what this actually has lah.
It's very rare lah. Is it?
So visual disturbance may be reported. May be reported.
Does it mention about the prevalence or the percentage? No.
Not yet.
Not yet. Maybe it's rare lah, or it's too common. They not there to write it in the.
We're not so open about this.
I don't know. I can't say anything because I don't know.
Alright, next continue on is reversible hypothalamic pituitary adrenal HPA or axis suppression may occur following systemic absorption of topical corticosteroid, which is something ingredient that's an ingredient that not mentioned here. They're just talking about it lah. Like there's one thing bad about this lah, so you have to be careful. Fucicort should be used with care in children as pediatric patients may demonstrate greater susceptibility to topical corticosteroid-induced HPA axis suppression and Cushing syndrome than adult patients. Avoid large amount occlusion or prolonged treatment. As we mentioned, no over long term lah. They have not mentioned what kind of long term, but they say no long term. So continue on is atrophic changes may occur on the face and to a lesser degree in other parts of the body after prolonged treatment with potent topical steroids. Glaucoma might result in the preparation enters the eye, which is in a sense this cream they would never prescribe to someone that has face eczema.
Oh,
Yes.
okay.
I guess people say you have a thick face skin or cannot lah.
Okay.
Yeah.
Okay.
Right. Continue on, raised intraocular pressure and glaucoma may also occur after topical use of corticosteroids near the eyes, particularly with prolonged use and in patient predisposed to developing glaucoma.
Oh, so anywhere near eyes, just
Basically,
avoid lah. Don't
this
use
wouldn't be on the face lah.
So you mentioned a syndrome called Cushing syndrome.
Yes.
I remember there's a
You're the customer?
no in Singapore there is a adverse event reported by parents. Okay, the parents they have a baby has a very serious eczema. Okay, which is not rare lah. A lot of parents have babies with serious eczema. So they go to Shopee. They went to Shopee and then they buy a cream, eczema cream that is like very popular with a lot of sales.
Not this one lah.
Not this one. It's like another eczema cream that is recommended by their some aunties lah. And it's written in Chinese lah. And the eczema cream they market it as like a TCM driven kind of thing, very similar to our message, but unfortunately we are not the same as them. Fortunately, we are not the same as them. And the cream, right, is unapproved and uncertified by any third party or even by KKM or Ministry of Health. The cream was very popular among Malaysian also, especially Malaysian Chinese. But I think after that incident, like Shopee decided to take it down every of this product listing. And that baby get hospitalized because of Cushing syndrome. What is Cushing syndrome? Like just now you described, right? It's like during short-term period of time, the skin absorb a huge amount of steroid. It become the whole baby become very red, and I think got like heartbeat stop for a while.
Because the muscle is too packed.
And steroid will cause your blood vessel to swell or something like that lah. It cause some effect to your blood vessel, and it cause some like your heartbeat stop for a while and something like that. Yeah, I don't know whether the baby is okay now, but it's a very concerning event for me to read the news lah. It's very unethical for a business to do such a thing. And then after that, the Ministry of Health of Singapore found out that they got the product and then they ran a test. It has a very, very high percentage of steroid in it. That's why they prohibit this product. Yeah. First of all, it wasn't get approved or certified by them, by Ministry of Health also, regardless of it's Singapore or Malaysia. But then that one is very scary.
So anyone actually with skin condition, don't think because Shopee is cheaper.
Or got a lot of reviews, a lot of stars, 5-star reviews.
Yeah.
Got a lot of like before and after, good. Parang sampai.
For skin conditions wise, yes, don't try to not buy for online services. Do get yourself checked and get recommendations.
A product that is approved and certified by KKM, please, please.
If you're Malaysian or anyone else, get your locals. Do make sure it's being certified by your locals. Continue on. For bodies of what we've been talking about, medicines you should not be using for a long time. This also, it does mention here, you should not be using it for more than 14 days when you when you first apply. Yeah.
Oh, there's a label here from the hospital to apply 2 days, 2 times daily for a week. A week only. This is a recommendation by the doctors and the pharmacies.
Which is the Penang hospital.
Yeah, the Penang one. The Penang hospital is a hospital from Penang.
Weekly or week?
For 1 week.
2 to 3 times for 1 week.
2 times per day for 1 week.
Which is around 14? Around
14 times.
14 times. But it is 14 days. So the doctors are more preserved. That means they do actually understand. Alright. Let's continue on. We're skipping towards the fertility, pregnancy, and lactations. Yeah.
Which means if you're pregnant, you should listen to these.
Yes. Or even you know someone that's going through, or even.
Or you have a wife that's pregnant, or sister that's pregnant right now.
Yeah. So do listen to this part, or even recommend to tell others to be educated on this. Pregnancy. For the pregnancy part, we'll be using the two main, which is the fusidic acid and betamethasone valerate. There's no effects. There's been studies that showed no effects during pregnancy are anticipated since systemic exposure to is negligible, and studies in animals have not shown teratogenic effects. But in the behind, I'll explain this later on. Actually, due to the corticosteroids, which is what we've been talking, you cannot use this on your face. Has been shown in reproductive toxicity, meaning you may not be able to give birth.
Oh,
Yes.
So it's still best to avoid lah.
Yeah,
Don't use lah.
That's the talking about the steroid which is that's not mentioned on the list on the box. The next one is betamethasone.
Or should I can say like there isn't a study that is
done on humans.
or particularly regarding this cream.
Yeah.
But corticosteroid,
Yeah.
there is a study suggesting that there is a link between pregnancy and
Yes. That's why they do have fertility, pregnancy, and lactations on the list here.
So yeah, if you're pregnant or expecting pregnancy,
If you have no chance, no choice to other than this as your medical.
okay, don't use lah. Don't use lah.
But if no choice, yeah lor. Betamethasone valerate, there are no or limited amount of data for the use of topical betamethasone valerate in pregnant women. That means
there isn't any study done
studies,
yet.
yes, only on animals. Yeah.
Not human.
No
Because
human.
no one want to sacrifice.
No one tried. Yeah.
Also not ethical to conduct.
Even there's a fine line here. Should not be used during pregnancy unless clearly necessary. There's a fine line there.
Okay.
So yes, if you are
Avoid lah.
if you're a usual user of this, don't suggest anyone that's about pregnancy to use this.
Or you have a old Fucicort or steroid cream inside your cabinet, and then you pregnant already, then
Don't try
suddenly you
this.
have eczema coming out, and then you think of like, there's an old steroid cream in my cabinet, I should use it, and take it out and use it during your pregnancy. Oh no, don't. You have a lot of other options that's steroid free for eczema. Think of your baby, okay? Think of your offspring.
Alright, moving on is breastfeeding. No effects on breastfed newborns.
There's no effects or no studies been done.
No effects.
There's a study
Meaning,
being done.
it says that Fucicort can be used during breastfeeding, but it's recommended to avoid applying it onto the breast. Meaning, they say it may not be transferable towards like saliva, but
Just nipple area, try to avoid lah, because
Yes.
your baby might get in touch.
Yes.
Okay.
it wouldn't
Okay.
be skin contact transferable.
Okay. Okay.
Right. Moving on is fertility. No clinical studies.
Okay.
Meaning, yeah.
Okay. So we don't know whether you use it for a long time will cause you to be infertile or not. Infertile means you cannot get pregnant or give healthy sperm to your wife or girlfriend to cause her pregnant lah.
Right, moving on is effects on the ability to drive. Though in short form, we will say you can just directly apply this. You don't have to use anything to help you apply. Meaning you can just
Can use finger lah.
you press this. For anyone that doesn't know, is a tube. You just press until the this cream come out, then you just rub on your skin only. You don't have to use anything to help you. All right. There are undesirable effects which we've been talking about. We'll be moving on towards the more. You have to be more cautious about this when you're using this. I'll be reading on. The estimation of the frequency of undesirable effects is based on a pooled analysis of data from clinical studies, which is the studies they've did. What actually are the effects, but not on the breastfeeding women.
Okay. So they have conducted a lot of studies, so they pull them all together to reach this conclusion.
Yes, that's why they are only able to sell this product. The most frequently reported adverse reaction, pruritus.
What is that?
Basically, I don't have, it's not something serious. It's just a medical term for itching.
Oh,
It's
just say itch lah.
I don't know. I mean, medical term.
Sounds like a Greek god.
Yeah, pruritus. So, okay, when you're applying this cream, meaning the most normal side effect you can get is just itch. Very itchy.
So if you apply more of this, you'll get itchier
You
all
want
the
to
time.
scratch. Yeah.
I really question about,
The way they write the question paper.
as in I really question about how they come up with this cream, and this is the most widely prescribed cream for eczema that is like so troubled by itching skin and thinner skin barrier. Then I truly don't understand.
All right. They've actually, this is the statistics is listed by Medra SOC. Let me look at what company. Medra. So.
Okay. I think it's a directory for any pharmaceutical company to report their adverse event or something like that. I think so. MEDRA means for Medical Dictionary for Regulatory Activities. It's a clinically validated international medical terminology dictionary thesaurus used by regulatory.
Meaning,
Basically, it's like a dictionary for them to describe certain clinical
terms.
observation, events, or something like that.
Sorry, they've not sent to them, but they actually just follow the list of what actually clinically.
Also, there is a adverse event classification dictionary within this MEDRA dictionary.
They've stated which is the levels of MEDRA, meaning they've shown you the very common is 1 out of 10 people. Common is 1 out of 100 and 1 out of 10. Uncommon is 1 out of 1,000 and 1 out of 100. Rare being 1 out of 10,000 and 1 out of 1,000. Very rare is 1 out of 10,000 people.
Okay.
Not if it writes not known, meaning
There's no clinical studies.
You cannot really know what is there. This is what the levels of MEDRA has lah. Right. For immune system disorders, it is shown to have very uncommon, unless you're very sensitive towards you personally is sensitive towards the ingredients of this cream.
Okay.
So which it has mentioned so some people actually they are allergic towards these ingredients. And the next is eye disorder. Not known.
Not known.
Vision blurred, meaning that's why they say do not apply this on the face. Yeah. So they don't know what's the percentage, but meaning they may not want to show up on this.
But first, on the first page of this information sheet,
we've been talking about about blood vision
So I think they know about the possible
effects
towards our vision, but they just don't know the
number.
Percentage, or they cherry pick the result. I don't know. Don't sue me, please.
All right. Next is skin and subcutaneous tissue orders, which is a very the data that you have here is uncommon and rare, but is very unsettling when it's for skin products. Yeah. For the first is dermatitis contact.
Dermatitis is eczema.
Eczema, skin burning sensation, pruritus, and dry skin.
Pruritus is itching lah. Reminder.
Next is rare, which doesn't happen more often. Erythema, urticaria, rash. There's even 2 rash levels, which is erythematous and rash generalized, meaning it's a more general.
Okay.
Right. For next is general disorder and administrative site conditions, meaning where you apply what would actually happen. You have pain, irritation, swelling, and vesicles.
Oh, like I mentioned before, steroid actually does a lot of things to your
Skin.
blood vessel also. So it will either disrupt or causing more of the blood flow to certain area. So I guess that's the mechanism to cause all the swelling and stuff like that.
Right. There's two fine lines they put. Is frequency is estimated by post-marketing experience, which means they've did data on like what people actually give them feedback about, and special warning and precautions for use. Meaning what they put it behind is because it's not important to see, but special precautions is what you actually have to watch out for.
Okay, so the product is there, but it's consumer own responsibility to observe their own body reaction and to caution themselves about all these potential side effects and to judge whether you want to use or not is based solely on the
Consumer. Yeah, so that's why they say 14 days.
14 days
Also,
max. Max 14 days not years. Please.
Right. And the next one, systemic undesirable class effects of this is talking about the corticosteroids, not about this product alone. So yeah. And also betamethasone valerate includes adrenal suppression, especially during prolonged topical administration, which is overuse of it. Yeah, meaning suppression, adrenal suppression. I think your adrenaline inside your body, meaning it doesn't go through. Yeah. Right. Continue on. The dermatological undesirable class effects of potent corticosteroids include atrophy, dermatitis, which is what we're talking, eczema, telangiectasia, rosacea, erythema, hypertrichosis, hyperhidrosis, and depigmentation.
Forgive us about all these pronunciation.
Yeah.
We'll put in a subtitle.
Depigmentation, I think it means like the skin tone, right?
Yes,
Losing the colour.
pigmentation.
Yeah, losing you even by this you may lose your skin color.
But don't use it as a skin whitening product.
No. I won't try to use it. You won't see me turning white in future episodes also.
No.
Because this thing is not fully. They don't have the ingredients for corticosteroids is not a lot, so they don't. When you use this, it's not really commonly seen the side effects, which means they don't use a lot, but then they're letting you know when you use this.
It's a potential side effect.
Yes.
Just 1 mg, like 1 milligram.
It's also a lot.
I don't know whether it's a lot but maybe over prolonged period of use, that is a lot.
And they've mentioned a section which is overdosing. For what they use the fusic acid, there's no studies about overdosing. Yeah. There's no information concerning what's the potential, what may actually
But
happen.
how about the steroid component of it?
Steroid, which is what we've talking.
The betamethasone. The
Betamethasone.
Beta.
I'm guessing nobody actually overdose on.
They mentioned too much already.
It maybe the betamethasone is a corrective.
Yeah, it is.
Then the corticosteroid, Cushing. Right. Moving on is pharmacokinetic properties. What we found out actually, pharmacokinetics is
how the drugs,
the body.
medicine flow in your body.
Because I think a movie called Lucy, is it? I think using the brain power. I'm not sure anyone. This is a movie reference. There's a photo.
Lucy by Scarlett Johansson.
Yeah, basically about the brain power, how much you can use, and it's because of the drugs, stuff in the stomach, then keeps on flow to the body.
Then becomes superhuman.
Yeah, this is like about it. Pharmacokinetics is how the drugs actually flow inside the body. Yeah. There's no data. They didn't do any studies about this.
I think it's also very difficult to track.
Because it may happen from something else.
Because steroid, I don't know how to mark it biologically or molecularly. Because for other medicine to run this kind of studies, they need to be able to mark the particular molecule of the drugs or the medicine. Only they can track it, like how
it's moving
move inside the body.
For reference, it's like anyone that's seen fishing things, like people putting a tracker on the fish or a shark, then moving around
like GPS for the drug. But I think maybe it's very difficult for someone to do it for steroid. That's why they can't do this kind of study. So we don't know how steroid move inside the body after you apply it. We don't know, no one knows because there's no study been done for this.
They do mention this inside the list is because the fusidic acid can penetrate through the skin.
Definitely can. Definitely
acid,
can.
being acid.
Yeah.
Right. Next would be the preclinical safety data. Meaning if it's not being sold in clinics first, I think. Yeah, it's talking about the corticosteroids, what we've talking just now. In animals, have shown reproduce toxicity
So it will cause
in pregnancy, infertility lah.
infidelity among animals.
Yeah, so I don't think they wouldn't try it on humans if they already tried it on the animals. Right, next is list of excipients, which is excipients meaning the ingredients that are actually inside.
Yeah.
But they don't mention about how much of the amount is inside lah.
Trade secrets. What?
Yeah, I'll just read through the ingredients. Sorry for my pronunciation, as the whole video is. First one is macrogol cetoceryl ether. The next is cetoceryl alcohol, cholesterol, liquid paraffin, white soft paraffin, sodium hydroxide for pH adjustment, which is the acidic level of this thing. Orec, tropical alpha, tropicferol, and purified water. Yeah.
Oh, there are water inside at least lah.
Incompatibilities, I think it means the drugs you're taking with. There's no studies about it.
Okay.
Meaning there's nothing shown that or different studies when you have different medicine, this one cannot take.
Oh, okay.
Right. Shelf life, meaning this can, if you don't open this, like don't take off from the box, it can last for 3 years. But if you already open the container, only use this for 3 months, meaning it can only last for 3 months. This amount, specific amount. Yeah.
But they mentioned before, right? The max is
14
like
days.
14 days.
Yeah.
Okay.
All right. Next is storage. How you put this thing?
Dry and cool place lah, in like
not store
common sense, right?
Yes.
Don't put it like on top of the stove or inside the car.
Packaging available. Actually, they do sell in 2 sizes. 5 grams. We'll put a picture if we found it. And this is a 15 gram section. Yeah.
And ours is 30 gram. Yay.
So this leaflet alone, meaning this box we got it, is revised in 2019. So maybe in new versions they may be more specific things.
Maybe they change the formula or there's like new clinical studies update to it.
Yes. So anyone that actually bought this even now or even trying out, do let us know.
Maybe they have new version of this.
Yeah. For anyone that cannot tell by photo, they even mention who is this manufactured by, which is Leo Laboratories.
Okay.
It's a Denmark company lah. This is a Denmark product. That's why you see red and yellow. Right. That's all from us for this episode. Talking about Fucicort Cream and what is the use of reading this paper.
Okay. So this paper actually quite important
Yeah.
But a lot of people don't read.
So do remember to read not just this thing alone, or even when you buy a new phone, do read the product manuals.
Get yourself educated lah.
Yeah. Even though it's very long. Even right now we're going through this.
We
1 hour.
record like for more than 1 hour just by reading this.
This episode is
Okay.
pretty long.
Hope it helps. Okay. Bye bye.
Bye bye.